right, so we will call the meeting to order. Joe, could you put the agenda up on the screen? Okay, so our agenda for today is up on the screen. Are there any amendments to the agenda from committee members? Seeing none, the agenda is approved. And then Joe, could you show the minutes from our last meeting on the screen? Okay. Hopefully everyone's had a chance to review the minutes from our last meeting. Are there any questions or comments on the meetings? If not, I would entertain a motion to approve the meeting minutes.
Move Michael Thompson.
Elaine Kutsuko, second.
Okay, I missed the first. Who was the first? Who moved it?
So Michael Thompson was the
Michael. Okay, I missed it. All right, thank you, Michael and Elaine. Any further comments on the meeting minutes? Seeing none, then everyone signify by saying aye. By roll, we're back to roll call. Joe.
This is the best part. Anoka County, McPherson. Nope. Carver County, Robgent. And if you're an alternate, call that out, please. Dakota County, Labrie.
Aye.
Hennepin County, Ellos.
Aye.
Ramsey County, Isaacson.
Scott Mareck for Isaacson. Aye.
Scott County, Jensen.
Aye.
Washington County, Leitner.
Aye.
7W, Witter.
Abstain, I wasn't present.
Tab, Kotsukos.
Aye.
MTS, Steve Peterson.
Aye.
Community Development, Michael Larson.
Aye.
Metro Transit, Adam Harrington. MnDOT Metro, April Crockett.
Aye.
MPCA, Innocent AO.
I will abstain. I wasn't here.
Mac, Reef. Richard Reef. Suburban Transit, Matt Fighton.
Aye.
MnDOT Freight, Shelley Meyer.
I'll abstain. I wasn't there.
Deed, Colleen Eddy. DNR is vacant. Bicycle seat, Kyle Sabota. Pedestrian seat, Mackenzie Turner Bargain. Met Cities, Bloomington, Carl Keel. Chanhassen, Charlie Howley.
Abstain, not present.
Lakeville, Paul Omi said he would not be here. Eden Prairie, Carter Schulze, or Schulze. I apologize if I get that wrong.
Thank you. Yeah, I'm the alternate for Robert Ellis. Aye.
Fridley, Jim Kozlucher.
I'll abstain, I wasn't present.
Maple Grove, Ken Ashfeld.
John Hagen for Ken Ashfeld. Aye.
Plymouth, Michael Thompson.
Aye.
St. Paul, Ross Beckwith.
Aye.
Minneapolis Engineering, Jeni Hager.
Aye.
Minneapolis Planning, Kathleen Mayel.
Aye.
St. Paul Engineering, Nick Peterson.
Aye.
St. Paul Planning, Bill Dermody.
Aye.
And for attendance purposes, no vote. FHWA, Josh Pearson, are you here? Or anybody?
I'm here.
Welcome. The ayes seem to have it.
Okay, the meeting minutes are approved, and I do see some members in the participant list that, for whatever reason, maybe came a little bit late, didn't respond, so just keeping track of the attendance there, Joe.
Okay, I will, I'll call everybody, whether they said anything or not, in the next item. Thank you.
Okay. Joe, has anyone signed in from the public to comment on the committee business today?
No, Chair, that has not happened.
Okay. And so then we will move on to the tab report, Elaine.
Thanks, Chair. TAB met on August 16th. For the chair's report, Jim Hovland reported on his appointment as the chair of the Transportation Committee for the U.S. Conference of Mayors. He requested some information on bullet points for the IIJA as it relates to the city's successes and challenges. He would like any ideas brought back to him by the end of August so he can bring those forward. Some of the new federal discretionary funds are specific to planning activities to help get projects ready for future implementation. Coming up with funding for this early planning work for cities can be difficult without a grant. For MnDOT, there was no report. For the MPCA, Frank Kolash reported that the electric vehicle school bus grant program has been extended. And the MPCA is also exploring stacking grants to provide additional funding for programs. And Kolash shared information on water infrastructure grant proposals. For the Metropolitan Airports Commission report, Kyle Crimmins reported on an ongoing public comment period for the MSP long-term comp plan, and comments will be received until August 21st. With the success of the transportation network companies, there has been disruption of traffic at the drop-off at the departure level at MSP. So the airport is adding an additional lane and it should be completed soon. And then MAC is also reviewing dynamic pricing for airport parking. For the Metropolitan Council report, Deb Barber reported on the work of the TPP work group, which you'll hear more at today's meeting, and is asking for additional member to represent the cities at the tab level. She also announced that Leslie Kendaris has been hired permanently to fill the role of the Metro Transit General Manager, and also reported that transit service is increasing and shared state fare service updates. For the Suburban Transit Association, Gary Hansen reported that the state fare service and Renaissance fare service is being planned for, and MVTL will have increased service coming in September. For business items, TAB had a busy schedule. They accepted the public comments and adopted the Transportation Improvement Program for 24 to 27. They approved the urban area boundary that came through this committee. The 2040 Transportation Policy Plan Amendment, which added 5 regionally significant projects, and that will be going out for public review and comment after it was approved by the Transportation Committee. The scope change request for Minneapolis E-Line Route Signal and Pedestrian Safety Project was approved. Also approved is the program year shift request for the Brooklyn Park projects for CASA 103 and CASA 30 projects. The RBTN map was approved to the solicitation, and then they also approved the release of the resolicitation and 8 SIP applications. And they've been approved by the Transportation Committee and will be approved by the Council September 13th. And there was an information item presented by Liz Roten of MTS on the transportation system performance evaluation. And that's all I have.
Thank you, Elaine. Are there any questions for Elaine on the tab report? All right, seeing none. The executive committee did meet this morning and talked about the agenda items for today. A couple other additional notes. I just want to thank everyone who responded to my email request that I sent out asking for some of the talking points for Mayor Hovland to bring to his meeting, the Conference of Mayors meeting. So thank you to everyone who responded to that. That information was all summarized and shared with Mayor Hovland. And then real quick, Joe had sent out an email working through funding and programming primarily to pull together work groups to look at the program year extension and scope change policies. This was talked about earlier this year, given some of these requests that have come through over the last several months, in particular for projects related to larger regional initiatives. We have some members who have responded, and we're looking to flesh out that membership a little bit more in those committees. And in particular, we are lacking city representation in those committees. I think there's only one city member so far. So this is a volunteer opportunity. If you all could just check in with your funding and programming committee members, and consider whether you are able to step up and assist with those working groups, that would be greatly appreciated. And with that, I will turn it over to Scott Mareck to provide an update on the Planning Committee and TPP Technical Working Group. Scott?
Thank you, Chair. The TAC Planning Committee last met August 10th, and the main item that was discussed was the draft 2024 Unified Planning Work Program that outlines the MPO staff work activities for the coming calendar year. One of the things that was sort of focused on during that discussion was a new requirement of the federal government to document how MPOs will complete streets work as part of the work program. And so staff will go over that in a very brief presentation, along with a couple new activities that are scheduled for 2024. But for the most part, most of the 2024 UPWP is a carryover from 2023. We also discussed interagency coordination work tied to air quality and environmental justice, and the September TAC planning meeting will be canceled so we can have a longer TPP technical work group meeting. A couple of things at the TPP technical work group level. We're continuing to work on preparing a new 2050 TPP for the region. The focus at last meeting was on objectives for the new TPP, and so Cole will go over that a little bit later on the agenda, but we are working on kind of reframing a few of the different objectives tied to the TPP that really kind of provide a vision for how we will invest in the region in the future. And some of the things that we're talking about reframing are timeliness of travel, climate change activities, and how we approach preservation of the existing system. We also talked about performance measures, and there's also a presentation today on transportation needs in daily life that will be presented to TAC as well. And Amy Vennewitz provided an introduction to the financial plan. We have to have a financially constrained transportation plan, so she provided an update for us on that. At the September meeting, we're going to talk about a number of different activities again, climate change, and also getting into conversation about highway investment, transit investments, and more conversation about the financial plan and VMT reduction. And that concludes my summary, Chair. I think you're on mute, Jenny.
Yep, sorry about that. Scott, did you want to touch on the leadership change with the vice chair?
Yeah, thanks for reminding me of that. And we also do have a new vice chair for TAC planning and the TPP work group. Bill Dermody has graciously stepped forward, so we want to thank him for his time, and he will be our new vice chair, as Angie Stenson, who was our TAC planning chair and TPP, or TAC planning vice chair and TPP work group vice chair, has left Carver County for another opportunity.
Great. Any questions for Scott? Otherwise, we will move to our action item 2023-44, which is the 2024 Unified Planning Work Program item and a short presentation by David Burns. Seeing no questions, and the introduction was already made by Scott, so Dave, I will turn it over to you.
Okay. All right. Great. Thank you very much. Just gonna set this up here. Okay. Which screen are you seeing here?
We're seeing your presentation. It looks great.
Great. Thank you very much. Good morning, everybody. David Burns, a planning analyst here with the council, and going to talk to you today about the 2024 Unified Planning Work Program, or UPWP. So the UPWP is required by federal laws for MPOs. Really, ultimately, it stems from the goals and objectives in our Transportation Policy Plan, or TPP. It also addresses pressing issues and concerns that are articulated by our local planning partners throughout the year. So it serves to really kind of outline in detail all of the work activities that we will perform in 2024, as well as the consultant studies that we will perform over the coming year. So like I said, it has our plan activities, studies, and associated budget. And importantly, it does serve as an application we must submit to MnDOT and FHWA/FTA in order to actually receive those federal transportation planning funds. So once it is approved, it is submitted by MnDOT to USDOT, and they transmit those funds so we can actually get to work on it. So it's organized by 6 major categories, as you can kind of see on the left. Each of those categories includes staff time and the associated cost with the staff time and consultant expenditures. So activity A, you can see the total staff weeks, the budget associated with it, the studies that will be continuing or starting in 2024, total consultant costs, and then total cost. I would say that task A is a good, or task 1 is a good example of a task that we kind of perform every year. This is like a lot to do with our tab TAC process, the regional solicitation, et cetera. So it's kind of ongoing, continuous work, and not so much kind of studies like you might find in modal systems planning, which are really kind of specific to the region on a particular year. So there you can see we have a number of studies and contracts that started either in 2023, will start in 2023 yet, or started prior to 2023, and will be continuing into 2024. So those are budgeted in our UPWP. New planning studies that we will begin in 2024 include a regional sidewalk data set, which will kind of get the parameters for what we want to gather for this regional sidewalk data set and kind of outline and create a scope of work for that. The Public Transit and Human Services Transportation Coordinated Plan update, a microtransit policy framework, important right there, the TPP goal topic workshops, and the evaluation of travel demand modeling, forecast accuracy, and robustness. So yeah, the complete streets discussion here, as mentioned, per federal law, MPOs must allocate at least 2.5% of our budget to complete streets. We've done that. It's still a placeholder. We still have to finalize flesh out some of the details of the budget. There's a lot of moving parts. We're going to be well above that 2.5%. Really, per federal law, as you can see there, is about, you can use that money for the planning, scoping, design, implementation, operation, and maintenance of roads in order to reasonably address the safety and accessibility needs of people of all ages and abilities using the transportation system. So we have identified tasks related to that, and then assigned budgets associated with those tasks. Right now, we're really only looking at staff time. Again, we're well above that 2.5% threshold. So no concerns in that regard, and that will be finalized prior to adoption here. So our draft budget here, you're going to see a total cost of 7.3 million. And it's broken out here by the number of staff weeks, the associated salary costs. The consultant cost is sort of that third column. We're over 2 million again this year, so there's going to be a lot of staff time devoted to consulting and managing those consultant projects. Our overhead rate, from what we were initially budgeting, came in lower than anticipated, which did free up a lot of funds. So we actually are taking 5.6 million of the federal planning funds, and we're going to sort of bank and use in a future year $400,000 of other CPG, Consolidated Planning Grant planning funds. So that's going to be used again in the future when we have a little bit more capacity to perform some of these studies. And with that is really that's it. Any questions that you might have? I'm more than happy to try to answer those. Thank you.
Thank you, David. Are there any questions for David on the presentation?
Madam Chair, this is Scott. I think I forgot to mention that TAC Planning is recommending adoption of the 2024 UPWP as presented by staff.
Thank you, Scott. If not, I would entertain a motion to approve this item.
This is
Madam
Lisa, I'll
Chair.
make a motion.
I think that was Lissa.
I'll second
Moved it.
that. This is Joe with Anoka.
We have a first and a second. Any further discussion on this item? All right, all in favor signify by saying aye by roll call.
McPherson. Aye. Rob Gent or Laborie.
Aye.
Ellos.
Aye.
Mareck.
Aye.
Jensen.
Aye.
Leitner.
Aye.
Witter.
Aye.
Kotsukos.
Aye.
Peterson. Steve.
Aye.
Larson.
Aye.
Harrington. Crockett.
Aye.
AO.
Aye.
Reef.
Aye.
Fighton.
Aye.
Meyer.
Aye.
Eddie. Sabota. Turner Bargan. Keel. Howley.
Aye.
Omi is out. Schulze or Schulz.
Aye.
I apologize. Kozlucher.
Aye.
Hagen.
Aye.
Thompson.
Aye.
Beckwith.
Aye.
Hager.
Did you say Hager?
Yes.
Okay, sorry. My sound is a little off today. Aye, sorry.
No problem. Mael.
Aye.
Nick Peterson.
Aye.
And Dermody.
Aye.
Thank you.
Okay, so that item is approved, and we will move on to a report from funding and programming. Michael.
Yes, thank you, Jenny. This last month, we did not have any official business, so nothing new to report on, but we do have a couple months worth of scope change or tip amendments coming up, and I know staff can speak to that, but I know we are holding our upcoming meeting and we will have new items to present in October. Thank you.
Thank you, Michael. And any further questions from committee members on the various committee reports? If not, we'll move to our information items. Seeing none, I will move on, and we have a presentation from David and Kathy with the Pollution Control Agency and the Minnesota Department of Health on the life and breath.
Yes, good morning. Can you all hear me? This is David Bael with the MPCA.
Yep, there is.
Yes, we can hear you.
Yes. Okay, wonderful. And I'm sorry, it wasn't clear. Are we going to control our slides, or I guess Joe or Heidi, were you planning on running the slides? I'm not clear where we end up.
David, that we didn't quite iron that out, did we? It's totally up to you. I can do so if you'd like. Otherwise, feel free if you feel like taking over.
I can.
Okay.
Is that working? Are you seeing our cover slide?
Yeah,
Yes.
It looks good.
Wonderful. Okay, great. Well, again, I'm David Bael, but I'm actually going to pass this on to Kathy to get us started with the presentation, and I'll introduce myself a little later. So, Kathy, are you there?
Hi, yeah, I'm here. Can everyone hear me?
Yes.
Okay, great. Yeah, thank you for having us today. My name is Kathy Raleigh, and I work for the Minnesota Department of Health. I'm an epidemiologist with our environment. And I've been in that 7 years now, I believe. And David and I have pretty much been working together since the beginning, since I started, and doing a lot of work on air quality and health outcomes. So I'm just going to give you a little bit of the context background of the study, the most current study, and then David will go into some more details. So if you have questions, if you want to do it along the way or at the end, maybe it's probably best. And I will just, because I'm not sure, see hands raised or anything, but anyway.
We'll do questions at the end, Kathy.
Okay, great. Thank you. So the first slide here, we have a little bit of a background on the Air and Health Initiative between the Pollution Control Agency and MDH. And it's been a long-standing partnership and collaboration between the two agencies. And about 20 people or plus or minus in the group who have come and gone over the years. But in 2013, the legislature directed us to work together and provided some funding. So we both have a common responsibility to protect the public health related to air quality. The current report that we're going to talk about briefly today is on the heels of 2 initial reports. The very first one you can see, the Life and Breath, the lighter blue, came out in 2015, and that was looking at air quality in the metro area. And then the one from 2019 on the right, the more teal color, that is an expanded analysis looking at statewide health impacts from air quality. And so this is a long-standing response. These reports and these analyses are a long-standing response to community and policymaker concerns, and looking at environmental justice in certain urban areas and then in rural areas as well. We're also looking at health inequities related to structural racism and other social determinants of health. And the current report that we're looking at is the metro area, and it'll be 3 other cities in Minnesota, and we'll describe that a little bit more. But those the outcomes from the previous reports were some of the things that came from those were the clean cars rule, and meaning more electric vehicles and less exhaust fumes, and then also federal funds that we received from the Volkswagen settlement, using those to build the charging stations and electrify the school bus fleet. So next slide. So a quick overview, health impacts of air pollution in Minnesota. Generally, we have very good air quality, aside from all the wildfires recently. But overall, we do have, and we meet federal standards. But we do see that the health impacts are not evenly distributed. So one of the purposes or goals for this study was to look a little bit more in depth on the social determinants of health and look at disaggregating some of the data so we could see who is most impacted. And then on the right, you can see a little diagram looking at some of the complicated variables that go into an analysis. So as we're looking at exposures, here we're looking at particulate matter and ozone, and what some of the underlying health conditions are in the population, including some of the social determinants of health, where people live, structural racism, and then the health outcomes. So we're looking at cardiopulmonary impacts and respiratory impacts. Slide. So the project goals, we wanted to look at the magnitude of air pollution and how it contributes to some of the cardiopulmonary hospitalizations and ED visits and premature deaths as well. We did this in 7 county metro area, looking at zip codes. And then we also did this in greater Minnesota, as I mentioned, in Duluth, St. Cloud, and Rochester. So our goal is to look at the differential impacts across neighborhoods or zip codes, and look at regional patterns and some of the overburden and disadvantaged communities. And then on a positive note, we wanted to quantify the health benefits, what it looks like if we reduce air pollution by 10%. So a little bit of an overview or background. We looked at PM 2.5, so fine particulate matter, and ozone. And we know that ozone, the ground level ozone is created through chemical reactions in sunlight. So reactions with nitrogen oxides and volatile organic compounds, mixing of those in higher temperatures. And then for fine particles, we looked, we know it's a complex mixture of solid and liquid particles, small particles, that in combination with organic chemicals, acids, metals, and solids and dust, things such as burning coal, diesel, wood, and other fuels that can create these fine particles. We also know that there are other things in the air, such as the wildfires, smoke, and things can be created indirectly through chemical reactions with other air pollutants. And here's an overview of some of the outcomes that we looked at. Shortness of breath, wheezing, chest pain, some of the outcomes from fine particles. And then it also can exacerbate some conditions such as cardiovascular disease, asthma, and COPD. And then ground level ozone, you can have inflammation of airways, difficulty breathing, shortness of breath, and then it can also exacerbate other things such as asthma, COPD, and emphysema. And next slide. And so for this current report, we looked at 4 social determinants of health. And so we expanded the previous analyses to look a little bit more in depth. We're looking at Black, Indigenous, people of color populations, poverty, uninsured status, and then also disability status. And here's just kind of a snapshot of some things that we see in the community, why we were digging a little bit deeper and looking into BIPOC populations that we know have the highest risk for being in communities with higher air pollution, and also people living below the poverty line, living within a certain distance of busy highways.
All right, I think, Kathy, I'm going to take over from here. Good morning, everyone. Again, my name is David Bael. I work at the Municipal Pollution Control Agency. My position is economic policy analyst. So I do various economic analyses, but also include health analysis around air pollution and climate issues at the PCA. So I am going to just get into some of the, first of all, some of the methodology of our study, and then talk a little bit about our results. So as you know, Kathy conveyed, air pollution is certainly associated with a variety of harmful respiratory and cardiovascular health impacts. But there are many determinants of health. So it's important to understand, how do we attribute air quality to health outcomes? So the key question is, how can the health impacts of air pollution be counted? So air pollution, like other significant health risk factors such as smoking or obesity or things like that, is rarely indicated as the cause of a hospital admission or a death in official records. So we can't just go out and count the health impacts of air pollution. Instead, we use statistical methods that apply epidemiological research findings about the relationship between exposures to pollution and the risk of illnesses and death across the population. And we apply these relationships to data for air quality and incidence of health, adverse health impacts, to estimate the fraction of those impacts that can be attributed to air pollution. The flow chart on this slide just summarizes our modeling process, the various inputs that went into the analysis, which include air pollution levels, underlying health incidents, various population data, and then taking those inputs along with the epidemiological relationships between pollution exposure and health impacts that I talked about earlier, and using a model called BenMap, which I won't go into the details of what that is, but that takes these inputs and is able to estimate the adverse health impacts in our study areas, which, as Kathy mentioned, were the Twin Cities metro area, Duluth, St. Cloud, and Rochester, and how many of those adverse health impacts are attributable to PM 2.5 and ozone pollution. This just gets into a little bit more detail in our methods. Just in the interest of time, I'm just going to not dwell on this slide. I do want to, though, just point out that when we talk about methods, in spite of what might seem to be very precise inputs and outputs, our purpose is to show the general magnitude of the problem of air pollution and health across the whole population. We're not aiming and not able to give precise estimates, of the health burdens of air pollution. Again, just more of the magnitude. It's what's called an ecological study, which is a population-based study that kind of gives a general sense of the magnitude of the problem. All right, so this slide begins to get into some of our overview of our results. Specifically, this slide shows how air pollution's contribution to early deaths in both the Twin Cities metro area and our 3 greater Minnesota cities. We estimated that air pollution contributed to around 10% of all deaths, or about 1,600 annual deaths in the Twin Cities metro area, and about 9% of all deaths, or about 280 annual deaths in Duluth, Rochester, and St. Cloud combined. For some context, this is roughly on a par with the number of deaths in Minnesota associated or caused by Alzheimer's disease, which is the 6th leading cause of death in Minnesota. And moreover, we continue to see disproportionate impacts. The four social determinants of health that Kathy mentioned, were areas with higher BIPOC populations, areas with more people living in poverty, areas with more people living without health insurance, areas with more people with a disability. These communities tend to bear the heaviest health burden of air pollution. This is certainly consistent with patterns we have seen in previous work, both in our two previous life and breath reports that Kathy talked about earlier, as well as other studies throughout the country on air pollution and health, and on looking at equity and environmental justice across the country. So while these disparities are caused in part by different levels of exposure to air pollution, a key thing that we have found, and we hope to convey it with this work, is another key driver of these disparities are the underlying health inequities or social determinants of health that Kathy talked about earlier. The maps on this slide just are a sample of the maps that we provided in our report briefs. The top map just shows the rates of early deaths related to fine particle pollution in the Twin Cities metro area zip codes, and the bottom map shows the rates of early deaths related to ozone pollution in Twin Cities zip codes. This slide just digs a little deeper into the premature deaths for the Twin Cities metro area. We have a similar, in our reports, we have a similar table for greater Minnesota cities. The key highlights here is that we see that air pollution contributes to around 10% of all deaths. And we can also begin to see some trends, since as Kathy talked about earlier, this is building on previous work. We did do a study of health impacts of air pollution in the Twin Cities based on 2008 data. And looking at the results of this more recent work compared to that previous work, we can see that the premature deaths attributable to air pollution have gone down. However, we still see that it is a meaningful problem. The final column shows another thing that Kathy mentioned earlier. We looked at what we would estimate as the premature deaths preventable with 10% air quality improvements. So we can see that roughly in the range of a couple hundred deaths, early deaths per year. So this slide shows our findings with regards to non-fatal but still serious health impacts of air pollution in the Twin Cities metro area. Again, looking through an equity and environmental justice lens. So overall, we estimated that air pollution contributed to nearly 500 annual hospitalizations for respiratory and cardiovascular conditions. And then in assessing disparities in how these health outcomes affect metro area communities, again, we investigated for socioeconomic indicators or social determinants of health for each zip code in our study. Those again are the percentage of BIPOC residents, percentage of residents living in poverty, percentage of residents without health insurance, and percentage of residents with a disability. We show on this slide also the 4 different serious non-fatal health outcomes that we looked at: asthma hospitalizations, cardiovascular hospitalizations, respiratory condition hospitalizations, and then emergency department visits for asthma. And what we found and what this graph shows is that for each of these 4 social indicators, areas with more marginalized groups, that is areas with higher BIPOC populations, with more poverty, with more uninsured people, and with more people with a disability, all had higher rates of impacts attributable to PM 2.5 pollution for every one of these 4 health outcomes. Just one striking example is that areas with the highest proportion of BIPOC residents had more than 5 times the rate of asthma emergency room visits from PM 2.5 pollution relative to areas with more white residents. This slide just shows that we see the same general patterns in greater Minnesota cities. So again, as Kathy mentioned earlier, Duluth, Rochester, and St. Cloud all have relatively good air quality, but we still find serious health impacts from air pollution in those cities. Overall, we estimated the air pollution contributed to around 50 annual hospitalizations and emergency department visits in these 3 cities combined. And again, the communities that in these cities that generally see the heaviest health burdens of air pollution are the areas with a higher percentage of low-income residents, BIPOC residents, uninsured residents, and disabled residents, which again is illustrated by this graph. So here's just a summary of our findings and the key messages we're hoping to convey with this work. Again, I want to emphasize that this is an ecological study that's looking at population-wide impacts. It's not attempting to pinpoint specific impacts on specific people. Rather, as I said earlier, it applies modeled air quality data and statistical relationships between air pollution and health across the whole pollution. Thus, again, our purpose is to show the general magnitude of the problem of air pollution and health and general patterns of these impacts across the population, and not to give precise estimates of the health burden of air pollution. So that being said, we see that even though air quality in Minnesota meets national standards, there are still meaningful health impacts of air pollution, even at low to moderate levels. And even though over time there have been reductions in air pollution and health impacts attributable to air pollution, there are still wide and consistent disparities in who is most affected by air pollution. And again, these disparities are driven by both differences in air pollution exposure and also, and importantly, by these underlying health inequities. And we certainly see health equity and environmental justice as inextricably linked together, which is why we see it as important that our two agencies, MPCA and MDH, will collaborate together to investigate this problem. And to address this problem, we need to both work on reducing air pollution as well as reducing the underlying health inequities, such as in healthcare, housing, and other social factors that influence health. We certainly see many implications of this work, many of which are yet to be thoroughly investigated. For example, in the realm of transportation, which I know is of interest to all of you, we know that lower income and socioeconomically disadvantaged communities are generally exposed to more pollution from traffic emissions. So reducing vehicle emissions will have not just overall health benefits, but also equity benefits in bringing higher levels of benefits to communities most affected by transportation-related pollution. But lower income communities are also generally more vulnerable to impacts from wildfire smoke, from climate change, as well as many other environmental hazards. So anyway, I'm just gonna wrap up by just saying, so what are we doing about the problem? So certainly we hope this work illuminates the need for action to address health inequities and environmental injustice, and further bolsters the work in these areas being done by our two agencies and the work being done by local agencies, certainly the Met Council included, other stakeholders, and communities themselves to protect and improve the health of all Minnesotans. This slide just lists kind of some of the key actions and strategic focuses that the MPCA is undertaking to address the problem, certainly reducing pollution in population centers and focusing on areas of concern for environmental justice is a key strategic goal for us, as well as reducing vehicle emissions, improving understanding of air quality at the community scale. We see that this life and breath work certainly factors into all of these kind of very high level strategic goals. Just want to also mention maybe very recent legislative milestones, which aren't on the slide, but that are very much at that intersection of air pollution, environmental justice, and also climate issues. I presume many of you are familiar with the cumulative impacts rule that the legislature just passed in the most recent session, which for the first time defines environmental justice area in a Minnesota law, and essentially just requires a cumulative analysis that in granting any permit in an environmental justice area, cumulative analysis that includes not just pollution burdens, but some of these other socioeconomic factors that contribute to vulnerability to air pollution. There's been other kind of big legislative highlights, but that's one I think that's particularly relevant to this work. So I think I'm going to just pass it back to Kathy to just talk a little bit about what MDH is doing in this area.
So MDH, there were several things, but a few highlights. As of last year, we had a new Health Equity Bureau, so we're focusing, putting a lot of our priorities and focus into this area. So health equity as a top concern. We also, at our environmental public health tracking program, we look at exposures in the environment and we track those over time and geography and look at populations who are most impacted with the highest level of health outcomes, everything from COPD to cancer to childhood lead levels. So it's a range of things. And we look at some of that goes into looking at vulnerable populations and looking at where we want to direct our future research and what areas of the state, what populations are most impacted. And that kind of goes back to the cumulative impacts that David was just talking about. The new piece of legislation, we will be involved in doing some of the analyses for that. So one specific example, our asthma program, they use some of the childhood emergency department asthma rates in the metro area, and they look at zip codes. And they work with local public health directors in for asthma home assessments. So that's one area. And then really looking at advancing some of the health-based guidance for the key air pollutants. We worked together when early this year when EPA came out with the proposed standard to change the standard for PM 2.5 from the 12 micrograms down to a range of 9 to 10 standards. So we had some input on that based on some of the life and breath work that we've done. And let's see here, next and last slide. Yeah, so summary and action steps. Again, you know, these two, health equity, environmental justice, those are linked. We do see disparities across the urban area and the state. We know that underlying health conditions, those increase vulnerability, and some of the actions, again, to improve these health outcomes, looking at population centers, looking at where people are most exposed and who they are and how to decrease those exposures and improve health simultaneously. And then we're continuing these efforts and we work with partners such as the City of Minneapolis, looking at air monitoring and several other communities in Minnesota. So I think that's it. Thank you. And I guess we'll take questions.
Thank you, Kathy and David. Are there any questions from committee members? Go ahead, Scott.
Yeah, thank you, Chair. Thank you for the presentation. I was just curious if you've done any work with electric vehicle fleet being ramped up. I think there's a plan over the next 15 to 20 years that the automakers will have a fully electric fleet that they'll be selling nationwide, and the degree to which that will impact air quality in Minnesota and across the country.
I can take a stab at that. Thank you for that question. Certainly, it's been a key focus of the MPCA to encourage and to advocate for policies to increase electric vehicles. I mean, studies have shown generally that you know, the overall impact in terms of both greenhouse gases impact as well as other pollutants, including the pollutants we're talking about, are generally less with electric vehicles compared to conventional internal combustion engine gas powered vehicles. So that of course depends on how clean the electricity grid is, and we have seen great strides in Minnesota and throughout the country in improving the cleaning our electricity grid in terms of lower emitting fuel sources. So I mean, your question, have we specifically done study to see what this kind of future 10 to 20 year plan for increased EV adoption will mean in terms of reduced health impact? I can't say that we've specifically made those estimates or done that kind of analysis, but we certainly do see that there are benefits, both climate benefits certainly, but also health benefits of increased EV adoption. So, and that is a major focus of ours. Certainly, I think Kathy mentioned the Clean Cars Minnesota rulemaking that we have done over the last couple of years is kind of a big part of increasing EV adoption. So that's an attempt to address that question. And Kathy, if you have anything to add, feel free.
No, I mean, I guess I would just say that there is a lot of funding now for community air monitoring. And so there's lots of opportunities to make these linkages, I think, and mentioned, City of Minneapolis, and they have a grant. So placing where to place these, how it looks, and, looking at, because these are like continuous data feeds. So looking at all the data over time, and there's certainly a lot of opportunity to work towards like understanding what the data look like over time as these EV stations come online. So there's opportunity for, the levers are there, so working together on that.
Steve.
Yeah, thanks. Steve Peterson, Met Council. Thanks for your presentation.
Really good. I was curious, one of the slides mentioned 300 meters as being, it's at a few city blocks, probably if you're close to a freeway. Can you talk a little bit more about how you came up with that and maybe some short-term solutions? Because the freeway system is largely going to be what we have, and the vehicles are likely going to be still going on those freeways, but we've got obviously some health impacts happening, and one thing the councils or the MPO is going to be doing later this year is a freeway harms study. So that's kind of in the back of my mind here too. But maybe you can just talk a little bit more about that 300 meters and what goes on with that. So thanks.
Yeah, I think
Sure.
that was. Oh, go, David. Do you want to start?
You could go ahead. I also see Innocent. I see you have your hand raised. I don't know if that's because you want to offer a response to that question or you have a separate question.
Oh, it was for Madam Chair.
Go ahead, Innocent.
Add further questions, but I can also add to that. I think there are several studies that have shown that most of the concentration of air quality or impacts within the first 300 meters or 500 feet. And also this has some implication in terms of air quality and placement of especially in land use. So coordination with most of the cities in their land use planning to avoid placing especially places like childcare or senior citizen homes and stuff like that quite close to the freeways. So it has some implication as there is some coordination between transmission planning and the land use and the cities to know where to place, because from a lot of several studies I've done shows the high concentration of air quality first 300 meters. But what are, okay, I will ask my question again, but David, you can go ahead and add what you wanted to say.
Yeah, I don't know if I have a whole lot to add to that. I mean, the kind of that statistic that we put up earlier about, we can't see the slide, but I'm looking at it. It says that about 54% of people in high poverty census tract live within 300 meters of busy roads. I was not involved in coming up with that statistic or doing that analysis, but I think it's just based on demographic data, based on poverty level in census tracts and obviously the location of roadways. So just a spatial analysis that did that. That was, I think, part of kind of some related work to this Life and Breath work, but separate work in our annual Air We Breathe reports, which are reports to the legislator just on the state of air quality in Minnesota, but also that look at these environmental justice issues. So I guess that's all I had to say about that. And Kathy, I don't know if you also wanted to add to that.
Yeah. So for our data portal, we call it environmental public health tracking. We do capture some of these data and look at traffic and certain food impacts. So we know that the annualized average daily traffic, the busy roads are defined with that of more than 10,000 vehicles that use that area. And we also know, based on previous studies, that within that 300 meters of those busy roads, that's where exposure is the greatest. So we can say by looking at census tracts, looking at population characteristics, who's most exposed. So who's living nearest those. That's helpful.
Yeah, thank you.
Innocent, did you have a separate comment or is your hand up?
Oh, yes. I wanted to thank David and Kathy for coming to give such a great presentation. After reading both report that they did, I talked to Joe to see if there is a chance for both of them to come and present their findings. to the committee, that committee, because we are the people that make some of these transportation planning decisions and policy making, and so we can also see what type of health impacts or other relative impact that transportation or transportation related impacts have caused. Another case in point is that David mentioned about cumulative impact rule that the recent legislature asked NPCA to do also not only the cumulative impact, but also 8,000 rules and reporting, so that some of these in the state level, they're making very serious policies for us to look at. At the federal level, they're tightening up the standard for PM 2.5, and they're looking at ozone also. And recently, NPCA, the private vendor was involved too. We just provided comment to multi-pollutant standard rules that the EPA is working on, tightening up the emission standard for heavy duty, medium duty, and light duty vehicles. And all this would make some of our work much difficult. So we have to try to work together to see what type of initiative and plans that we can use to help reduce air quality impact, especially to those in the environmental justice areas. That's just what I have.
Thank you, Innocent. Go ahead, Joe.
Well, Innocent started off by thanking them for their presentation. So I'd like to thank Kathy and David for their patience with the presentation, because we ended up continually having a lot of big meetings. So this could have happened at any time since about May. So I appreciate them waiting through and getting bumped at least once. And I'm glad that we were able to work it out during a manageable meeting.
Well, thank you. Thank you so much for having us. Thank you to Innocent for facilitating it, and to Joe and the full committee, and to share this work.
Yes.
Yeah, and
thank you. Go ahead, Kathy.
Oh, I was gonna say I put a link in the chat, and that's our traffic data on our portal, but there's other links to air quality data and other outcomes, health outcomes. But yeah, and I'm happy to, if you have any questions, our email should be on there. Happy to answer questions, reach out, thanks.
All right, thank you, Kathy and David. Any additional questions from committee members? Okay, seeing none. So thank you both for this very helpful presentation. Really appreciate it. It's very, very relevant to a lot of the work that we're doing right now, we'll be doing in the future, especially with the 2050 TPP development. It's a lot to think about, and will be really relevant as we work on those, policies and objectives that will guide really our transportation work for the next, couple decades. So thank you so much. And we will move on, seeing no further questions, to our next information item today, which will be presented by Cole and is an update on our 2050 Transportation Policy Plan development work. So go ahead, Cole.
All right, good morning, everyone. I know if I was in person, there'd be a rousing good morning back at me, but.
Good morning, Cole. All right, your presentation's up. We can see it.
Can you still see it? Is it full screen?
It's full screen. Yep, looks good.
Good. Yeah, well, thanks for having me. I'm going to talk about the 2050 TPP, and we have quite a bit to go through today, so I'm glad we have plenty of time on the agenda. And I think per Chair Hager's recommendation, we want to try to get through the whole presentation and reserve discussion at the end, and we have some questions highlighted at the end. I would say if there's any kind of clarifying questions, we might be able to take those during the presentation. But I'll defer to Joe or the chair to and let me know because I can't really see the hands.
I will watch for hands, Cole, during your
Thank you.
presentation and let you know.
So a couple of reminders. It's been a while since we've been at TAC on the specifically on the TPP, although we have had an amendment recently. The TPP has two primary roles that are guided by state and federal law. One is an investment plan that directs and identifies investments in major projects. In particular, directs all federal transportation dollars. It's also a guide for local planning. So it provides local governments with the vision and the system that we're planning to invest in, and then they do comprehensive planning that is consistent with and conforms to that system by providing land use and local transportation and other things. We do set policies that guide how the regional transportation system should or will be implemented, and that can kind of cross over both roles of investment plan and local planning. So we do have a number of committees that have been diving into detail on the TPP, and this just kind of shows their relationship to the rest of TAC and the TAB. And you can see we have a 2050 technical working group that is TAC planning plus some additional members that's been meeting essentially after TAC planning since late last year. And then the TPP advisory work group, which is policymakers that includes both TAB members, Met Council members, and other members. And so that group tends to focus on high-level discussions. Wanted to put this schedule slide up here up front just so you all are familiar with where we're at. We've been doing a lot of work on visioning and policies and actions. We're starting to dive more into the writing process and going to start reviewing technical chapters starting this month and into next month, and all culminating in adoption process starting early next year. But I just wanted to note that I'm going to talk a lot about more of the middle section here, the goals and objectives and policies and actions today, recognizing that our investment plans are still being drafted. So back to those working groups, the technical working group has focused on reviewing technical stuff, and we'll dive deeper into the content review for the chapters. And we've also been engaging other working groups of TAC, like the Bike Ped group and the Transit group. And we purposefully included the chair of TAC to track this discussion and also determine when things might go to TAC. At the advisory work group level, we include the TAB chair. They've been scheduled every month this year. They were meeting every other month last year. And they've been focused a lot more on the vision level discussions and getting high level information on the TPP development. So at TAC and TAB, we had a few presentations to date. So the left column here just summarizes when we've been to TAC and TAB. We kicked it off in May of 2022. We came through the TAC and TAB on Regional Development Guide and some of the goal language and vision language earlier this year. This is the first substantial update since then. And other than that, we've just been doing regular updates through the TAC planning update at the TAC meeting. But on the right side, you can see a little bit more of the detail of what the technical and advisory work group have been doing. They actually spent 4 separate meetings on the Regional Development Guide vision. We've talked a lot about engagement and how we've been engaging with our partners on the TPP outside of the committee structure. We talked about scenario planning and early policies and actions development. And then we've had a substantial amount of discussion on transportation studies, the information that they're producing, and what it all means for the TPP long term. So this is more of a reminder slide that we have a slightly altered structure for the relationship between the TPP and the Regional Development Guide. Previously, all of the system plans under the Regional Development Guide had different structures for things like goals, objectives, and policies. And we tried to simplify it and use the same structure across all plans, which just resulted in a slightly different approach for the TPP than we've had previously, where we'll be having high-level regional goals that all system plans will be trying to achieve at the regional development guide level, and then focusing the transportation plan on interpreting those into transportation objectives, policies, and actions. And so we're going to focus more on that objective level today. So this is the current working draft of the regional vision and goals. The vision is somewhat like a little elevator speech that we might be able to give folks on what the plan's core elements are. The goals are more of a strategic framework for how we make decisions and how we guide our decisions moving forward. So you can see we have 5 goals that the council has loosely endorsed, recognizing that they're still working versions, but they've endorsed these as the working versions for now. And they are that our region is equitable and inclusive, communities are healthy and safe, our region is dynamic and resilient, and we lead on addressing climate change, and we protect and restore natural resources or natural systems. So I'm not going to spend a ton of time on this slide, just noting that we're going to go into more detail on the transportation components of these later in the presentation. We have done quite a bit of engagement. We had actually consultant-supported engagement that kicked off earlier this year when we were back at TAC in February. That was right around when we were kicking it off. So there is both engagement that was conducted with government partners, particularly counties, cities, transit providers, and MnDOT. We also engaged with other small groups through our equity engagement consultant, and met with various groups that represent equity and climate or aging. You can kind of see the list there on the left side. We also, in addition to doing these listening sessions where we sat down with all of the agencies, we did prioritization workshops where everyone was invited, everyone that was engaged within the first round. And that helped us craft the objective statements and review them and prioritize them that you're going to see today, in addition to the follow-up discussions that we had at the technical working group. So there are summaries of all of this engagement that are, I would say, 99.9% done. We expect them to be posted on the TPP webpage probably in the next couple of weeks, but a lot of good information that will be in there, and it'll be helpful for you all to look at, and we'll share that with TAC once it's available. So moving into the objectives, this is really the heart of what we've been talking about at the groups for the last 2 months. We had to draft transportation objectives with really 2 major inputs: all of the stakeholder engagement and work that we did throughout the summer and throughout the spring. As one, I would call it more of the ground up, hearing from people about what's important to them and what issues we need to address, but also taking into account the top-down structure of the regional development guide, the goals that we have as a region overarching all system plans, and try to find a sweet spot in there to match up our priorities with all of those inputs. We originally had started by thinking we were going to be drafting transportation goals and objectives. So this change to the regional development guide structure did happen a little bit midstream, which changed our focus more to the objective level. As such, the objectives do end up sounding a lot like goals in many cases. They may not have that measurable component to them up front, but we are subsequently working on a performance measurement process that will provide more detail. So just keep that in mind when you see the draft language, that they're trying to state our intent of outcomes that we're trying to achieve as a region, but there will be more detail coming in subsequent months. So we did review the draft objectives with the Met Council Transportation Committee, the Technical Working Group, and the Advisory Work Group over the last couple of months. Initial objective proposals were presented in July, and then we presented on some refinements last month. And we even have additional refinements today to share with TAC. This will be the first time, and there's just some tweaks that we have made in response to the feedback we got in the second round. So we are drafting the 2050 TPP, and because we've started the policy work and drafting the chapters, we are trying to get you to the point where we can say, here's what content you should be drafting based on. It doesn't mean that these objectives are finalized. It's more just saying that we need to kind of timestamp them and say we can start our other work, which we have started. So we'd take feedback and consider it as we move forward, but just recognizing that we've already put some of these out there to start drafting the TPP so that we can keep moving that work forward. I wanted to highlight, and as I go through these, you're going to see this similar approach where there's a topical area, some important points that I wanted to highlight, and then some quotes from the engagement that help illustrate what we heard about this topic from our different partners. So the first one, I think there's a couple of overarching concepts that we wanted to highlight that aren't going to be reflected specifically in the objectives. And the first one is that the TPP needs more focus. Basically, when you want to do strategic planning and you want to be strategic about how you invest, saying that everything is important means that nothing is important. And I think we hear this a lot during the regional solicitation. It's gotten too complicated. There's too many things we're trying to address. And as a result, there isn't a clear strategic focus either for the region to react to or for individual applicants to react to. So you see some comments there that, basically we heard from one stakeholder, I can fit any project into the TPP's goals and strategies. It's not difficult because it basically says everything is important. So that was one thing that we took into account when drafting the objectives, is trying to be more strategic about what we say is important. We also heard from some counties that they do not support the 2040 TPP or the 2050 vision. Equity and climate change in particular were raised as concerns, and that different contexts require different approaches, so we can't do a one-size-fits-all approach to regional planning. And so we tried to capture that when we think about moving forward with the plan, particularly in the policies and actions and that context-specific application. So the first objectives that we wanted to talk about were under the goal of our region is equitable and inclusive. And we have 3 objectives listed here. First one is that historically disadvantaged communities are better connected to jobs, education, and other opportunities. The second one is that we repair and eliminate disparate and unjust impacts and harms to BIPOC people. And that the third one is that we better meet the transportation needs of people who have disabilities or limited mobility. And that red text that's underlined is a portion that we've added since the technical working group last saw this, and that was based on feedback that we got at the advisory work group that, disabilities is often a more narrowly termed phrase, and that limited mobility encompasses more, that people that might just have, trouble strength-wise getting upstairs, things like that. So this was heavily emphasized as a critical topic during our stakeholder engagement. One of the things that we have heard as we've brought this through the committees in the last couple of months is that the focus of equity needs to be clearly defined, particularly at the regional development guide level, and the interpretation needs to be clearly laid out so that people can understand what we're trying to do here. In 2014, I think there's still a lot of concern when we brought forward the racially concentrated areas of poverty that was too narrowly focused. And so there's that idea of stakeholders want to see what this means. And there is a process within the council to help define equity officially for the regional development guide. And as that comes forward, we'll certainly bring that to the different committees for review. I should also note that we actually didn't have a disability objective at first, and that was added after part of our feedback through the committee, and that was a great recommendation and suggestion through that process. So the second one is our communities are healthy and safe, and we actually have 5 objectives here, so I'm going to focus on them in 2 different slides. But the first 2 objectives are, I like to call them partnered objectives. There's one about physical injury and death not occurring on transportation. And then the second one there is more about the feeling of comfort and safety and welcomeness while using transportation. So Generally speaking, there's been really strong support for these concepts. Safety certainly emerged as our clear #1 priority during our stakeholder engagement. I would say by a healthy, large margin, it was the #1 priority. And so we tried to emphasize that in the objectives as much as we could. And these two in particular were really well supported by all of our partners. The next three are more, I would say, centered on the health component than the traditional safety component. And the first one is that we mitigate and avoid harms to people caused by nearby transportation. So we just heard about that with the previous presentation about air quality impacts. We also know noise impacts, and we added light impacts as an example based on recent discussions, are things that we want to mitigate and avoid as we build out the system or as we operate the system. Another component is that people are better connected to their community and cultural resources to support all of their forms of well-being. And I like to think about this one as a community building, and the health of a community overall is part of what we're trying to achieve with transportation. You know, there's different ways you can look at this. One of them might be access to the different resources that you need to support your health and well-being. Another might be just that you have good public spaces to create a sense of community, and transportation can facilitate that. So there's different elements to that objective. The last one is that people can increase physical activity with more opportunities to walk, roll, or bike. It was actually a little bit surprising to me, just because of past history, this hasn't been the case, that health was emphasized as one of the most important topics by our partners, even separate from safety. So safety was high ranking, but health was as well. And that just acknowledging from our people that were commenting on the objectives, that they really talked about health being a core element of what we do, and that it should be heavily emphasized in our plan. So something for us to think about. It's not heavily emphasized in some of our funding criteria or programs, but certainly emerged as a top priority from our partners. The third goal is our region is dynamic and resilient. And this is an area where we have a few different transportation topics that are emphasized. The first one is that people and businesses can trust that the transportation system will withstand and recover quickly from all types of disruptions. So this is basically a really strong resilient objective. And it's not just about avoiding it, but it's about recovering quickly if incidents happen. So I kind of bucket that one separately as resilience. The next two are about travel time for people in particular. So the first one is that people can better meet their daily needs with timely, reliable, direct, and affordable options beyond driving alone. The emphasis there is really on making modes like biking, walking, transit more attractive generally. There's an acknowledgement that those are at a competitive disadvantage within the region. We've spent a lot of time and effort building out the roadway system, and that we haven't quite paid the same attention to those other modes, and so we have some catching up to do. The third one is really about travel on the highway specifically, and that people will experience more predictable travel times without excessive delay when traveling on highways. So we acknowledging there that delay is a natural occurrence within a congested metropolitan area, and that we want to focus our investments on eliminating or providing options outside of that excessive delay, and really focusing on predictability and reliability more so than reduction in delay. And then the last one is kind of taking that same concept and putting it into terms of freight and goods. One thing that we know that's true for freight and goods, it's also true for people, is the value and predictability is much more important than the value on travel time, because they can plan and budget around travel times. It's a lot more difficult to plan and budget when you have unpredictable travel. So we've got a lot of feedback on this over the different meetings that we've had, and created more of a clear delineation between highway and travel options objectives. I think we still have some discussion worthy of having there, so we want to revisit this at the end, particularly the second and third objectives here. The the fourth topic is that we lead on addressing climate change. When we had originally presented this, we had one objective, and it was very similar to the top objective here, that the region's transportation system minimizes its contributions to climate change. When we presented this, we heard from, particularly from the technical working group, that we need to say more about this topic. It's really important, and to have just one objective doesn't really emphasize the importance of this topic moving forward. And so we decided to add 2 objectives that focus on areas where we have substantial investment categories. So we had originally proposed the 2 black objectives below there in the black text. By 2035, we'd have 100% of new light-duty vehicles, newly purchased light-duty vehicles registered or as zero emissions, and that 45% of all vehicles would be registered as zero emissions. Just recognizing that it takes a long time for the fleet to fully turn over. And then the second one is that by 2050, the region would reduce VMT per capita by 20% below 2019 levels. And there was some feedback that that level of specificity was maybe concerning, and it's not clear if we need it. So we are going to put out some more generic objectives that you can see in red there. And again, we'll revisit this later on in the presentation. I would just note that those objectives with the more specific numbers were sourced from the statewide multimodal transportation plan. And so we're just trying to align ourselves with MnDOT and the statewide plan with those proposals. And so that's a discussion worth having of whether we want to do that or whether we want to be more generic in the metropolitan area. The last one was pretty straightforward. We protect and restore natural systems. As you might imagine, this is really important to some of our other system plans like parks and water resources. But for transportation, a lot of this is regulated through environmental law. So it's still important to emphasize, but we feel like there's a pretty strong focus on some of these elements already happening with projects. And the objective that we stated is that we just limit the impacts on the natural systems like air, water, vegetation, and habitat quality. So a couple of additional considerations that we talked through. You might notice there's no objectives on system preservation, and we had gotten some feedback from the council that they wanted objectives to be people-focused, and objectives on preservation are more system-focused, and they talk more about the infrastructure, not about what the infrastructure delivers for people. Also, that recognizing that system preservation can often be a competing objective with other priorities when they really should be done in concert with each other. And so we're trying to emphasize through our plan that system preservation is a policy that all stakeholders will be doing. But when you're doing system preservation, you should be trying to achieve the other objectives in the plan. So, if you're doing a preservation project, you should look for ways to make it climate friendly. You should look for ways to be equitable. And that's really going to be how we're going to emphasize it in the plan. We'll still have investments, of course, and policies around system preservation, but the focus is more on how do we achieve those other goals when we're doing the preservation that everyone is already building into their structures. We also talked about competitive economy. This wasn't really strongly supported as when we had put out potential objectives here. I think there's an acknowledgement, particularly from our policy maker level, that the economy needs to be emphasized in the plan. It's something that we're all universally working towards, a strong economy. But one of the things that we heard that was really interesting is folks were saying that if you do all of your other objectives well, the economy happens as a result of that. And so it's not an outcome of our investments so much as it is the outcome of doing our investments to get at the other goals and objectives. And this is still a discussion that I would say was happening at the council level, but we heard that pretty clearly in our transportation engagement. And one of the things that we wanted to note is that freight, of course, is one of the big parts of that competitive economy. And so we tried to capture freight and the objectives under dynamic and resilient. So I just wanted to show this too, as we think about how policies might reflect the system preservation approach. we're actually in the policy development stage right now. So these are just conceptual. They're not any kind of proposals, but recognizing that as folks invest in system stewardship, that the system priority can be given to projects that advance other transportation objectives. So as we look at preservation, prioritizing projects that have an equity component or a climate component or natural systems component first would be one way to perceive this policy approach. We've talked to some stakeholders that are already doing this. They look at preservation, they say, we're going to focus our preservation on areas where we have other opportunities first, and then come back and backfill some of those. But this is just conceptual at this level. As we develop more policies around this topic, we'll bring them back to this group for more discussion. So speaking of policy development, we are actually in phase 3 of this. We had started phase 1 by looking at existing TPP policies and strategies and grouping them into this new structure for the plan. And we had to, at that point, we had to actually group them by functional area, whether it was mode or potential impact. Now that we have goals and objectives, we're starting to reorganize them under those goals and objectives, identifying gaps and opportunities, and then starting to work through the more detailed actions for different agency types. And because this is becoming a very big process, we are forming project policy development teams that are topical based, and they're going to talk through this in more detail, bring forward some recommendations, and then we're going to have some workshops later on this year to talk through the full list of policies and actions with a variety of stakeholders, potentially including TAC, if you all want to be invited. So those teams are small, generally 6 to 8 people. They'll help us draft and recommend policies and implementing actions, and eventually we might use them to review measures. There's about 3 to 5 meetings. We've kicked off a few of the groups already and starting to work through that process. At workshop that we're thinking about, potentially 2 half-day workshops, probably sometime in October, to review the recommendations and continue to talk about them with a broader audience than just so smaller groups. So we're still trying to figure out the details of that, but that would be an opportunity for TAC maybe to engage in more of a hands-on way, because we think of it as maybe some small tables or an open house style rather than presentations at a large committee. So we'll use that input to continue to refine the policies and actions through the rest of the year. And we're also utilizing some of those working groups like Bike Ped and Transit to help us on those topics. And this is the list of policy development teams. You can see it aligns pretty well with the objectives. We split a few of the topics into 2 groups, particularly safety and public health. We're split into 2 topical groups. And then travel time and reliability and transportation options were split up along with resilience. So we have more policy teams than goals, but it was to help manage the workload for each of the policy teams. One other topic to touch on is the TPP structure. We're keeping a lot of the same structure in terms of investment chapters for modes as the previous TPP. We are going to add some contextual chapters around the goals. So you can see we'll have goal chapters that talk about why this is important, what are our objectives and measures, and then what is our general high level thinking about investing to achieve this goal. Shorter, kind of like high level chapters on the goals that will help bridge the gap between our strategic planning framework and our investment chapters. So those are going to be new. And that's just something that we're going to have to spend some time working on and reviewing with the technical working group. Also, the regional development guide is going to have a transportation specific section. We historically have had a TPP overview somewhere around 80 to 100 pages. We're going to cut that down and just include it as a component of the regional development guide that gives high level summary of the TPP within the context of the regional development guide, and then has the additional transportation chapters as a separate deliverable. I already kind of covered this, but this is essentially what those regional vision goals chapters will we'll discuss. So as we get into more detail, we're starting to draft chapters. We have a chapter review process that we're proposing where we're going to, particularly for large chapters or new chapters, we're going to do preview info items. We actually have info item previews on transit and highways coming this month to the technical working group. We'll then do info item chapters on the actual Word documents themselves at the technical working group. That starts next month. And then generally they'll get a month at the technical working group to review and circulate the chapters for more comment. Keeping in mind, this is all the informal review. This is not the formal public comment process. This is a working drafts review type level. And then we'd report back on changes or comments, major themes that we heard from that first round. And really the purpose of this is to try to space out the review. So it's not reviewing, 10 or 15 chapters all at once. But it does require coordination from technical working group members with others and their staff. And I don't think TAC has the capacity for this level of review, at least not at their regular meetings. So I think we have questions today about how can TAC be engaged in that review process. And here's just a preview of the general approach. So the preview is those high-level presentations. The review is the actual document release, and the changes is the follow-up schedule. And these are all dates for the technical working group. So you can see about 2 to 4 chapters being released at once. We tried to space this out based on the length of the chapters. Some chapters like transit and highways are much longer and a lot more in-depth content. So tried not to overload those with other major chapters at the same time. So this is the working TPP schedule. The next slide I'm going to talk about a slight change, but just note that chapter review process is what we've started now, and over the next 6 months or so, that's going to be the focus of the technical working group. When we started to talk about this in more depth across all of the system plans, we recognized there was a discrepancy between their anticipated public comment process and our anticipated public comment process that didn't seem fair to our partners to put a TPP out there in advance of the regional development guide. And so we want to do a slight tweak to the TPP schedule where we keep the existing development schedule that includes review of the chapters starting next month. And then once we get to March, which was the planned date to start the adoption, or I should say the release for public comment at TAC planning, just take a pause, maybe have the committees act, but not fully release the plan for public comment until August. And that gives us a few months to work through any remaining issues, maybe have some additional review from our partners during that phase so that we give adequate time to make sure that the plan is in good shape before it's released. The only real consideration here is that this will likely push the final adoption into early 2025, which could mean that some TAB members who voted to release it for public comment are not on TAB anymore, particularly elected officials if there's elections that might impact their participation. And so that is a risk that we were trying to avoid because TAB tends to like to vote as a board on the final product if they release it for public comment. So just something that we want to be wary of, and we can talk more about if there's any concerns about that. But I think because there's, for most representatives on TAB, there's a technical staff person heavily involved at the technical level. That's less of a concern for the elected officials, and the citizen and modal reps tend to not turn over until April or May based on how we have to solicit applications and things like that. So with that, I can move into the discussion portion. We have some targeted questions. Maybe I'll just pause there to see if there's any questions before we move into this discussion.
Any questions for Cole? And I think just before we go into the discussion, Cole, if you could go back a couple slides just to the timeline, I just want to make sure that TAC members are, this is just a workload awareness and management item, is just looking ahead at the next, probably 6 months or so, a lot of these reviews do closely align with when agencies are going to be putting together regional solicitation applications and then helping with the scoring process that goes with that. So I think that's largely unavoidable, but just something for you all as you're managing staff time and workloads to be aware of over the next few months here. So I see Scott has his hand up. Go ahead, Scott.
Yeah, thank you, Chair, and thanks for the great presentation, Cole. I think as I'm thinking about all of this, I know that one thing that we've discussed as we got into the TPP is trying to draw a better connection, a more direct connection between the strategic direction of the TPP and how we're actually investing in the regional solicitation process. There is some connection to that right now in how we fill out the application, the various application forms, but I think we've heard from a number of stakeholders that people would like a little more clarity and a little more direct connection between the strategies and the TPP and how we're actually investing. And I know we have the regional solicitation reevaluation process that's coming up as well. So I guess I'm just wondering if Cole and or Steve, if you could speak to how we're really going to maybe put a finer point on connecting the strategic direction of the TPP to how we're investing in the regional solicitation process. Thanks.
Yeah, Madam Chair, if I can start and then I'll let Steve chime in. I think that is a lot of what we heard, both when we do regional solicitation review periods and surveys. We hear a lot of that feedback that we need to tie it to our regional planning and vision. And so there's a couple of things. We have this big evaluation that's going to take 2.5 years. So that'll be post TPP work. But what we want to do with this TPP is strike a balance of giving strategic direction to the regional solicitation, but allowing that flexibility of that study and work process to determine more of the details. So we think that goal, objective, policy level will illustrate some of the things that the solicitation should focus on, but allow that study process to fill in more of the details and then potentially come back in 2026 to do a TPP update to reflect more of that regional solicitation content that's developed. And so I think you're right on that we need to give direction, but we don't want to be so prescriptive that there isn't flexibility through that regional solicitation evaluation process. And that is definitely the balance that we want to be able to strike. I think we warrant some more discussion on that down the road when we get more of the policies and actions. And I think that'd be a really great topic for TAC to weigh in on a couple months from now. Steve, you want to add anything on that?
No, nope, that was a good response. I think you're right. The kind of the goal and objective level is probably our goal is that would show up very clearly in the 2026 regional solicitation. And where it gets a little more murky, as Cole mentioned, is once you get to the kind of the policy and actions level and or kind of performance measures area for how prescriptive the TPP should or should not be in some of these areas. But certainly at that higher level, you could see, for instance, the objectives or goals could end up being, criteria we use. That it could end up being that's the application name. Or some iteration of that to make that very clear linkage between the two. But those are the details that we'll have to work out in that regional solicitation evaluation. Quick update on that while I got the mic here. That is going to our council September 13th for final approval on that consultant contract. And so we've been working on hard to keep that moving along and kind of a final announcement on that will be post September 13th. So thanks.
And the bulk of that work won't kick off until the TPP is more or less drafted. So we're gonna be able to work through the TPP issues before we dive in really into the regional solicitation.
Okay, should we go back to your discussion topics a few slides
Yeah,
forward?
and I think, these first three are focused on the objectives, and I'm glad that Scott brought that up because, that idea of are these objectives going to be important? I think what we're saying is yes, they're going to help drive investments in the region. And so making sure we get the language right is really important. We've heard a variety of opinions about how to handle multimodal investment and the need to strategically focus highway investment. One of the things we've been hearing a lot about is that these two are often in conflict with each other. If you make a highway wider, more reliable, it can sometimes work against the idea of multimodal travel. So we're trying to strike that balance by being more strategic about where we invest in highways, focusing on excessive delay and reliability, and then more broadly focusing on multimodal options. So I guess the question is, do you all, when you read these, do you feel like they're striking that balance? Do you have any suggestions for improvements to make that more clear?
Any thoughts from committee members? Oh, there's a hand. Okay, go ahead, Lisa.
Some of where I'm pausing is in the words like excessive. What does excessive mean? And so I think the word predictable travel times to me better balances where these things are in conjunction, but the word excessive means very different things to people. And so I'm wondering if we strike that word and talk about things being predictable. And then a little bit the same thing in some of the verbiage in the climate change of the word trust. What does the word trust mean in trust in zero emissions vehicles? But yeah, putting it more on the predictable side as opposed to talking explicitly about delays. Maybe how to balance that, but I don't feel super strongly either way, but trying to avoid words that don't have an explicit definition or can point people or more feely words, if you will, that folks feel differently about, interpret some of those words differently.
Paul, did you want to follow up on that at all, or else we have more hands up?
I'll just note that I think excessive was a pretty important one for us, but there is a need, as Lisa said, to define that, which we are working through in the performance measures piece and as we develop policies. But I think you're right. Without definition, it doesn't mean anything. And in fact, a lot of these words don't mean anything without definition. What does even predictable travel times mean? And so performance measures piece will help tease that out, but certainly hear you that we need to make sure that we know what all of these terms mean if we're including them.
Go ahead, Joe.
Thank you, Madam Chair. Yeah, a quick question related to the climate change objectives there. I'm more in favor of the ones in red. I think there are a lot of plans and there's a lot of discussions going on right now, like Cole mentioned, the statewide multimodal transportation plan has goals and targets called out in it. There's some being proposed in legislation, even some legislation that was passed this last year. So I think it's best that we keep it a little more generalized, a little broader as we start looking at this. And again, when you look at the SMTP, a lot of that's on the state highway system. This program here is really getting into more of our local road system. And we're still trying to evaluate how we're bringing all this in to our systems. How are we going to adjust for this? I think there was some good commentary from counties previous in Cole's presentation here that alludes to that fact that, some of this is tough to bite off on right now because we don't know the answers. We don't know how we're going to move forward. So being more broad, I think helps this plan. Thanks.
Thanks, Joe. Go ahead, Ken. Oh, go ahead, Cole.
Just one quick reaction, which is that, the text in black is basically sourced from the SMTP, and The one nuance is that we don't anticipate having targets in our plan, at least not this go around, maybe with the plan update. And so we thought that this is one area where there's targets and explicitly MnDOT had a recommendation that MPOs adopt a VMT target and consider the state option. So this was one way to get around that, but certainly hear you, Joe. A lot of the ground is kind of moving underneath us, so where we focus is difficult to determine. And so we could maybe identify that target setting as a future stage, but what we're hearing is that setting those targets is important, at least from MnDOT's perspective.
I'll just note that the way I read the red text versus the black text, in particular on that first one, is that, you know, zero emission vehicle infrastructure to me is inclusive of sidewalks and bikeways and all those active transportation kind of, you know, pieces of our roadway system. Whereas the black text is very, very, very specific to, you know, vehicles themselves. So, go ahead, Kathleen.
Thanks. A couple things. One, I had a question on the change from in vehicles to on highways, and is that just meant to indicate like on local roads and such? That's not the goal? Is that why that change was made?
I think two things. Number one, there was still some confusion about what vehicles we're talking about. You know, was it bikes? Was it other things? And we wanted to clarify it's vehicles that are experiencing excessive delay on the highway system, because this is an objective meant to focus our highway investments. So it's inclusive of transit and cars, but it's not inclusive of, you know, vehicles that shouldn't be on the highway, like bikes and other things. So that was just almost to provide more clarification about what the intent is.
Okay. I tend to agree with Lissa's point about the excessive delays versus predictability, but I do think if you define excessive delay and link to wherever that definition is, that'll help. And then in terms of the climate change ones, I get that things are moving under us, but I also feel like having something to target to and really measure, like how are we going to measure trust, right? And if we want to, I just think there's a lot of strength, and I've seen through the Minneapolis plans that we've adopted recently how helpful it is from a planning perspective to have some of these really defined targets related to VMT reduction, or, I mean, we don't have one like the top one, but I can imagine that being helpful and measurable. And I think that when I go back to like one of the first slides that you presented on in terms of some of the feedback you heard and the stakeholder engagement, like we can fit a lot of things within what the goals are. The red seems more of that nature versus the black being more directive and definitive. I do like Jenny's point about the fact that the top red one is more inclusive than just vehicular travel, but maybe there's a way to have like the top black bullet, a black bullet that addresses non-vehicular, right, zero emissions vehicles, like thinking about mode shift, that type of thing. And then that third one.
So I just wanted to know, and because I didn't put it on here, we are keeping this top bullet, which is that the region minimizes its contributions to climate change. So I think other things like that, you know, like electric
sorry,
bikes.
I meant the second bullet being the top
No.
bullet. Sorry.
I know. I'm just saying we're keeping that first bullet, which encompasses some of those elements that you might say you're trying to capture in the second one. So things like construction activities, electric bikes, those would all be captured under the first objective of we just generally minimize our contributions to climate change. So the point of the second two is to be more specific to vehicle charging infrastructure and VMT reduction. But hear you. I mean, it is striking that balance.
Okay, you might need, if you're going to go with the red text, you might need some clarifying words in there then. If you want it to be more specific to vehicle charging infrastructure. So I'm gonna move to Innocent.
Yes, Madam Chair. I think we prefer us to have a kind of specific or measurable goals or targets I know we work with MnDOT a lot on the statewide transportation plan, also with the climate action framework, where we get into the specifics and see how, when and how can we arrive at those targets. So I think it's really reasonable to have specific targets than those in the red that is just kind of general, you know. It's not kind of specific to general, just having people to trust in zero emission vehicles. So I don't think that really make the plan or specific goals that we're trying to reach. So I prefer the one in the black. At least kind of specific and know where we're working toward.
So preferring the black text over the red text for the specificity that it provides.
Yes.
Okay.
So, Madam Chair, this is Lyndon. Can I ask a quick question about that?
Sure, go ahead, Lyndon.
So where did the 20%, I know that SMTP was referenced, but where did the 20% number get vetted and come up with? The reason I ask that is I believe that's a statewide target, right? It's not just a metro region. Is that correct?
Correct.
So we're just going to adopt the statewide one, even though we're a metro region. I guess that one I think needs more discussion on that number. And until we know that, is that related to everybody, or is it related to the state highway system, or is it every road in the region?
Yeah, I'll let Tony maybe chime in. I see him come on camera. We are, just so you all know, we are planning to have another discussion about those two objectives around climate change at the technical and advisory work groups this month. So your feedback, we can take that and kind of bring it to that group. But some of their questions, Lyndon, were around, yeah, how did we get to those numbers? How did the state get to them? What were their thinking? What was their methodology? And so we'll dive into that more at the technical working group this month.
Very
Right, Tony,
good.
you want to
Thank
chime in?
Yeah, Chair and committee members, I believe the 20% per capita originally came from kind of a look around at what other agencies are doing, other states, other regions, and you know, there were people that were more aggressive, there were places that were less aggressive. And so this was the starting point. The conversations I've been part of, you know, when we talk about our region as opposed to the statewide goal, and the goal, the SMTP, I think is the plan for all roads in Minnesota. But how it might apply to the metro area as opposed to the state, I think the conversation's always been that the metro has more opportunities to reduce VMT than other places. So the question has been if we should be taking a bigger share of that VMT reduction work.
Thank you, Tony.
Yeah,
Any
that
other
was kind of my
follow-up on that
point,
one,
Madam
Lyndon?
Chair, was that maybe and without knowing that, we shouldn't really put a number in here yet, I don't think. So I like the general language much better at this stage. Maybe a follow-up would be to be more specific later. Thank you.
Tony, is there a timeline on that conversation of what that number should be for the metro or how it gets adjusted for the potential within the metro area?
Chair, we are going to bring this discussion to the advisory work group next Friday. And we're going to bring a representative from MnDOT is going to present how they approached this. I think that'd be a good place to continue this conversation.
Yeah, and you know, we have time over the next couple of months of finishing the draft of the plan to keep working through specifics if as the desire of the different committees. I think there is flexibility to do what Lyndon said and maybe come back with a future amendment to address that. But that would be something we'd want to commit to in our work program item. You know, what do we want to do to get to that number if we do that? Because I think MnDOT's definitely looking, particularly the metro area being half the state's population, and having a plan for how we're going to address the statewide targets.
Okay, and we talked about this before, Cole, but one other helpful way to maybe to frame this in terms of like, what does this actually mean, right? What does this mean for an average person with their daily trips would be super helpful. Otherwise, it's really kind of hard to even understand how any one person's decisions help contribute to something like 20% per capita. What does that even mean? So I gave you the example that we did in Minneapolis, which is equating it to how many miles less per day each person would drive, which would get to that goal. That's just, it's helpful context. I'm going to go to Carter.
Yeah, thank you, Chair. I just in general, internal city staff, we just talked about favoring the more broader, objectives, I guess, and then just an observation on that first climate change bullet, comparing basically the reducing the vehicles, the registered, and then the red statement underneath it is kind of a change in direction. And I don't know that those two are exactly related when you're really talking about vehicle reduction versus more. And I read this as really vehicle charging stations, access to and trust. I think the trust part is the trusting that there will be a charging station available to you when you're traveling. And I'm not sure if those two completely align together as an alternative for that, the black statement versus the red statement, like the other one does. So, to me, that red statement seems like it should be more like just a reduction or an increase in registered vehicles would be the broad version of that, similar to what the second one is. So just my thought on that. I didn't read it as more sidewalks or infrastructure like that. That it more specifically meant to me the charging stations versus registered vehicles.
Yeah, Chair, if I could, I would say that is somewhat where the feedback we got from the advisory work group is that having objectives focus on how we're specifically going to invest in supporting zero emissions vehicles was a desired thing rather than having this thing that has so many other things weighing in, like manufacturers' capacity and things like that. So that is some feedback that we're taking into account too. And that's the reason that it looks different, is because we're trying to take into account that feedback, that it should focus more on our role in supporting electric vehicle or zero emission vehicles. Similarly, there isn't a charge at the statewide level to have a local target on EVs or zero emission vehicles like there is in VMT. So those can be looked at differently in that vein.
Any further discussion on this slide from committee members?
The next slide should be pretty short, I think, because it's really focused on the question that you brought up, Chair, about the schedule, any concerns that you anticipate. Particularly, how do you all at TAC want to be kept involved with what the technical working group is reviewing? I think Chair Mareck from the TAC Planning and Technical Working Group can always report out on what they discussed last month at TAC. And then we can see if there's any additional follow-ups needed at TAC. But outside of that, are there any desired ways that you want to be kept in the loop? Should we just defer to Scott and Jeni to kind of determine when to come back to TAC, or any other topics that you maybe think warrant more discussion?
Go ahead, Lissa.
I'm sorry, I got a call, so I was tuned out there for a few minutes. Is there any I know there's a lot of overlap on the TPP staff working group. I forget all the names of the committees working on this, not the policy one, but the working group. And so the TPP specific group and then TAC. I'm wondering if where there's not overlap, is there a way to make sure those folks specifically are engaged separately or brought in somehow? I, for example, have one of my staff on that TPP working group, so I don't feel like I need as a TAC member to be engaged super specifically or have review time, but I just want to make sure that others who don't have representation on that committee have a way to be as involved as they feel like they need to be. Does that question make sense?
Yeah, I think the only group that really comes to mind is different cities. So there's some cities that might be on one and not on the other, just because of Metro City's appointments or help with that. So I think we can strategize around that, Lissa. But most of the other agencies are state or county, and they have representation on all the groups. So that should, our kind of presumption is that coordination can happen behind the scenes at those committee or at those agencies, similar to what you said.
So along those lines, then we would, Scott and or I would provide a report probably each month on just the activities that are happening with respect to the TPP working group. So you can check in with your working group member or members in the background, as Cole noted. And then just bring more in-depth updates forward as needed or at the request of committee members. And we would try to kind of do a scrub of those Metro Cities members that maybe need to get engaged more directly. I like that idea. Anybody else have any thoughts, questions, concerns, or comments? Okay, seeing that, I know we lost a few people off. We are a little over time. Cole, thank you for this update. It was very thorough and helpful. So I really appreciate that. And thanks everyone for sticking on a little bit late and providing your thoughts and input. Are there any other discussion items or agency announcements for today before we adjourn? Seeing none, then we are adjourned. Thank you, everyone. We will see you next month.